Rotary International's theme for December is disease prevention and treatment, and I thought that I would ask Ramesh Ferris, a Rotarian from Whitehorse, Yukon, to talk a little bit about polio. Ramesh was born in India in 1979 and contracted polio when he was 6 months old, leaving his legs paralyzed. With a lack of rehabilitation options, his birth mother put him up for adoption, and he was adopted by a Canadian family in the Yukon as a toddler. After 3 surgeries, he now walks using a cane and has a brace on his right leg. Ramesh rode on a hand cycle from Victoria, BC to Cape Spear, Newfoundland in 2008, raising more than $300,000 as part of his Cycle to Walk campaign. Part of that money went to Rotary International's End Polio Now campaign. He has also traveled to numerous countries, including Afghanistan, Pakistan, and the United States, where he has met with healthcare workers, businessmen, and government leaders in his push for education and more funding in the fight against polio. Ramesh was inducted into the Canadian Disability Hall of Fame for his tireless work helping to raise awareness and money towards eradicating the crippling and potentially deadly disease. Here's Ramesh.
Hello, my fellow Rotarians in the Rotary District of 5370. My name is Ramesh Ferris, a polio survivor and Rotarian with the Rendezvous Rotary Satellite Club in Whitehorse, Yukon. It gives me great pleasure to be able to speak with you today and provide you a little update on where we're at on our journey together as we work towards ending polio. In 1985, when Rotary International started its Polio Plus program, it was estimated that there was 350,000 new cases reported annually, spread out over 125 countries. Canada reported its last case of wild polio in 1977, and in the United States, the last case of wild polio was reported in 1979. Both countries, Canada and the US, were declared polio-free by the World Health Organization in 1994. Since the start of the world's largest public-private health initiative called the Global Polio Eradication Initiative, which officially commenced in 1988, there have been a $17 billion US investment towards the fight against polio. And this has been provided by well over 100 public and private sector donors. And Rotarians can be proud of the fact that Rotarians alone have provided 2.1 billion US out of that $17 billion total investment towards the fight against polio. Rotarians not only have provided financial contributions, but they've also vaccinated nearly 3 billion children in over 122 countries. That's completely amazing. And this is where we're at today because of the continued commitment that Rotarians demonstrate in our efforts to fight polio. Polio is not endemic in 125 countries anymore. We're down to the final 2 countries, Pakistan and Afghanistan. And to date, we don't have 350,000 new cases of polio. It's almost the end of the year, and we have 138 cases. But I have to stress that 1 case of polio is 1 case too many. We need to continue the fight in our efforts to ending polio. Our call to action is to eradicate the second disease in human history. Our call to action is to eradicate polio so we can live in a polio-free world. And in order to achieve that goal, we need to continue to advocate, fundraise, educate, and vaccinate. Rotarians have done a tremendous job in ensuring that high-level advocacy and partnerships are continuing in our efforts to end polio. I love this photo here. It's a photo at the Rotary International Convention that was held in Atlanta, Georgia. And this was at the polio eradication pledging session where $1.2 billion was committed between government, Bill and Melinda Gates Foundation, Rotary, and other partners of the polio eradication program. It's quite amazing what Rotarians can do when we work together in cooperation with others and we don't give up. Rotary advocacy efforts have influenced well over 10 billion US dollars in government contributions to the overall efforts in ending polio. The World Health Organization has budgeted that it needs 4.2 billion US dollars for polio eradication activities from year 2019 to 2023. And as of November of this year, 2020, we have a funding gap of 400 million US dollars. So it's highly essential that we continue the high level advocacy to ensure that governments around the world are committing and delivering on the much needed funding that the World Health Organization needs to continue its polio eradication activities. In our district of Rotary 5070, our polio donation goals is to ensure that every club will donate each $1,500 US dollars. And this can come from a club, or it could come from individuals within that club. But it's essential and important that every club ensures that they're donating to Polio Plus a minimum of $1,500 US dollars. That's been the goal that's been established by our District 5370's leadership team. Last year, out of the 60 clubs established in our district, 25 of the clubs achieved the goal of $1,500 US dollars towards Polio Plus. And there's 10 clubs, which I won't mention any names, you know who you are, but there's 10 clubs that haven't provided any dollars to our efforts of ending polio in terms of achieving that goal of $1,500 per year. 3 years ago, our district yearly contributed 200,000 US dollars to the fight against polio. And we're on target this year to achieve $100,000. And last year we achieved $161,000 towards polio eradication efforts. It's important that every dollar makes a difference. And so we need to be able to give as much as possible. It's been a tough year with COVID, and that's understandable. But we also have to remember the commitments that we made as a Rotarian family, and that is to eradicate polio from this earth. And in order to do that, we need your valuable financial contributions. So I really implore you that you work with your clubs to ensure that we can achieve our Rotary District goal of ensuring that we are getting the $1,500 US from each of the 60 established clubs in our Rotary District of 5370. A case of polio anywhere in the world is a threat to children everywhere in the world. So now more than ever is the time to donate. And if you donate now, you can make your donation work 3 times as harder because of the partnerships we have with the Bill and Melinda Gates Foundation with the 2-to-1 match. So please, please continue to donate to Rotary Polio Plus, and let's ensure that all 60 clubs achieve that $1,500 US annual goal. There's other things to do than just providing financial donations to Polio Plus. We need to educate our community members about the importance of vaccinating their children and as adults, ensuring our vaccines are up to date. So I've been impressed to always see Rotarians stepping up to the plate and going above and beyond and doing the extraordinary in terms of creating awareness and promoting Rotary's effort to ending polio. Here we have some vehicles that are deckled out in End Polio Now. Rotarians around the world have participated in October 24th World Polio Day events. They've been having dinners and events. This year is a bit different because of the pandemic, but even with the pandemic, there's been Zoom dinners. In our own district, we had a Pints for Polio, which was wonderful to be a part of, and we were able to raise some funds as well. So now's the time to be innovative and find unique ways to raise awareness and funds to ending polio. When we're able to travel again, I would encourage you to participate in a National Immunization Day, because we still need to vaccinate children around the world to ensure that the wild polio virus has no place to go. And so we need to ensure that children continue to be vaccinated as long as the wild polio is out there and it remains a threat to us in the world. And here's a photo of Rotarian Richard Ramos when he was in India providing the polio vaccine to children. And thanks Richard for your work. I thank all Rotarians that have participated on National Immunization Days, giving their time to provide that gift of the polio vaccination to children around the world. If you haven't been on a National Immunization Day, I encourage you to speak to someone who has. It's a life-changing experience for yourself that would be doing it, but also for the child who's receiving that gift of the polio vaccine. The Rotary Foundation has 6 areas of focus, and it's actually 7 areas now, but here we have peace and conflict resolution, water and sanitation, maternal and child health, basic education and literacy, economic and community development. We have the environment, environmental protection, and then we have disease prevention and treatment. And December is Disease Prevention and Treatment Month for Rotary International. But I would hope that every month is disease prevention, because by you providing financial support to Rotary Polio Plus, you are supporting the Rotary Foundation in its areas of focus and supporting specifically disease prevention and treatment. So please, please continue to give. People ask, where does the contributions to Polio Plus go? They go to a multitude of different areas. You're not just providing funding for the vaccine. You're providing funding for transportation, surveillance, social mobilization, volunteer and staff uniforms, and technology. And it's important that you continue to fund the Polio Plus program so that this work, this critical work, can continue. The polio program lends its support to support other health initiatives. So you're not just supporting polio eradication efforts, you're providing support for outbreak response expertise, laboratory networks, and disease tracking systems. So that, a time like COVID, for instance, this is how polio workers are fighting COVID-19. They're coordinating outbreak response, they're educating communities on prevention, they're investigating cases, they're training healthcare workers, and they're helping with contact tracing. So this is all because of the infrastructure that Rotary International developed with the Polio Plus program and the Global Polio Eradication Initiative. It's truly acting as a blueprint to combat other diseases like Zika, malaria, and as well COVID-19. So the long-term implications of our work and investments for polio eradication is serving a multitude of different things to ensure that our world is a healthy and safer place. The World Health Organization predicts an additional 10 million children will be paralyzed over the next 40 years if we don't continue our efforts in eradicating polio. Dr. Jonas Salk has a wonderful quote I always love to share when I give little presentations. He says, "Hope lies in dreams, in imagination, and in the courage of those who dare to make dreams into reality." My friends, my fellow Rotarians, I thank you so much from the bottom of my heart for all that you have done in our efforts to eradicate polio. But I'm here to remind you, our work is not complete. And as Rotarians, when we make promises, we do not break them. And we don't just go halfway, we go all the way. And together as a Rotarian family, we will continue to work towards polio eradication until we together cross the end polio finish line. And I just want to implore all of you that I just hope that you continue to donate financially as much as you can and of your time, so that together we can live in a polio-free world and cross that polio-free finish line together. Thank you so much. It's an honor to be a Rotarian in your district of 5370. Thank you, thank you, thank you. Take care and all the best.